Good afternoon and welcome back to our media briefing for today. As you may have heard last night, states across the nation are beginning to consider how and when we may be able to reopen our businesses and various sectors of our local economy and our civic life in general. And we are doing that exact same thing here in San Diego. In fact, this afternoon, I'll be joining Mayor Kevin Faulconer to formally announce the launch of the San Diego Economic Recovery Advisory Group, which will begin laying out the steps on the road to recovery. This will be a regional group that will have representation from businesses and various chambers and organized labor. And the group will have regular meetings starting actually next Monday, looking at a variety of issues, including how businesses can reopen safely while adhering to public health orders that prohibit mass gatherings and maintain social distancing, and what new measures will these new sectors be introducing as we enter into what I think everybody is calling a new normal. Let me be clear about one thing though. This group will do the groundwork so that we as a region can start thinking about how we can safely and smartly reopen. This group will not be focused on the when, this group will be focused on the how. I know people have lost jobs and businesses are struggling, but when we reopen, we must be guided by medical data and by the advice of our county public health officer and medical experts. We can't afford to blindly rush into anything, and we will reopen, but only when we are convinced that doing so will not endanger any lives. Let's not forget that the measures we've been discussing and planning for reopening is because of our adherence to the social distancing and other safety measures that have been introduced by our medical experts. We need to keep that up if we want to reopen. We will be providing more details later and in the days to come, and we thank you for your patience and your continued effort in this battle. Let's continue with today's briefing. We're going to be hearing from Supervisor Fletcher with an update on the informational charts and graphs, and then we'll get a medical update from Dr. Wooten. Supervisor Fletcher.
Thank you, and good afternoon. We are now about 2.5 weeks into April. We have certainly crossed the halfway point, but we have a ways to go in our April month of action and focused efforts. And to reiterate the point that you've heard many times over, this relative success that we've had in San Diego County in slowing the rate of transmission and flattening the curve compared to other jurisdictions and other entities is because of all the actions and steps that we've taken. As people rightfully talk and speculate and think about when some of those measures may be taken, it's important to note that removing those measures would also remove the success we've had if it is not done very carefully. If it is not done at the appropriate time, if it doesn't have the right triggers and test and infrastructure built in to accommodate it. And so it is vital to know that everyone at the county is working very hard to prepare us for changes in the future, but the ability to do that is in large part predicated on our continued success in the month of April, and it is predicated on our ability to put in place easements down the road that will be done in a thoughtful and methodical way. We don't want to undo all of the progress that's been made. We don't want to throw away all of the sacrifices, and we don't want to end up in a bad situation. We want to make sure that we do this right, and in order to do it right, we have to continue to be on a solid footing. And so today we reiterate the need for each and every one of us to continue, as difficult as it may be, to do our part. I know that it gets hard. We feel like we've been in this forever. It is easy to get antsy. It is easy to lose focus a little bit, and some of that is natural. But we all need to daily remind ourselves that the actions we're taking are ones that are designed to save lives, to protect public health. They're also ones designed to put us in San Diego County in the best possible position to come out of this. We did really good as a region on the front end. Now we need to continue that same momentum and do really good as a region as we continue through our continued adherence and as we prepare in the future to move into a new phase. And so we ask for all of your help. It is easy to see that it seems like some folks are out a little bit more and doing a little bit more. And while we fully recognize the need for essential jobs and essential services that you have to leave to do that, we want to continue to try to hold fast to this month of April. We're going to jump into our mobility metrics, which show us a little bit of that slippage that I just mentioned. It is a sense that we are not quite where we were. We don't have quite the same level of commitment and adherence. If you take a look at the first one here, on retail and recreation, what you can see here is the decrease in red is a negative number, meaning we're trending 5 percentage points in the negative for retail and recreation. Grocery and pharmacy saw a pretty significant change, and I suspect some of this is a little bit natural. There was probably a rush. People went. They hugely stocked up on groceries. Remember, all the shelves were empty. Now folks may be in a little bit more of a routine of buying a little bit more normal levels, and we certainly understand you have to go to the grocery store, you have to go to the pharmacy. Those are essential services, but a pretty significant negative trend here week over week. One we would certainly like to see this at least stabilize next week, if not improve a little bit. The next one we're going to look at, parks, a very modest change there, not significant. Transit stations, a little bit of a change there. I will tell you our ridership numbers have not changed significantly, so that one is not as concerning. The workplace numbers, essentially unchanged. As you can see right there, we're kind of holding steady, 1 point in the wrong direction, but not significantly bad. And residential, a little bit more in the positive. So this is folks staying at or near their homes, and this is a very, very encouraging statistic. So again, as we move forward, we want to continue to see that adherence and guidance. I don't know if we have the California scorecard available, and this is one where you can see right here, we did slip a little bit. Last week we were a C+, we've moved down to a C-. In fairness, the entire state of California slipped a little bit. I think what we're going through here in San Diego County is not uncommon to the state as a whole. The state went from a letter grade of a B last week, I believe, to a C, and we moved to a C-. I was hoping this would be the week we would beat Los Angeles County. We were tied with them last week. We're tied again this week. We will update these charts, but I think this is a reminder to us that we have to continue to work, and we have to continue to hold ourselves accountable, and we have to continue to have the patience and the fortitude to see this through, certainly for the entirety of the month of April, and then we can begin to see what the future looks like. So we ask for your continued help and assistance. Convention Center testing, I want to give an update on that. The Mayor, City Regional Task Force on Homeless, Housing Commission, County of San Diego are all jointly involved in the operations at the Convention Center. Thank you to the Lucky Duck Foundation of Family Health Centers. We have increased testing capacity that they acquired so that we could begin the process of testing everyone in the Convention Center. That began on Thursday. It was the first day they did any testing. They had to get set up and begin to get moving. 53 tests were conducted yesterday. 34 of those were negative, 19 are pending. Pending just means we're awaiting the results. So again, they performed 53 tests on the first day, a mix of both guests in the Convention Center along with staff. 34 negative, 19 we're still waiting on the results, and we will continue to provide regular updates on the progress of that operation at the Convention Center. Now we're going to jump into our daily reports and our charts here. Today we're reporting 71 new positive cases in San Diego County. Takes us to a total of 2,158. Between yesterday and today, we're reporting 1,114 new tests were conducted, which brings our total testing over 30,000, 30,246 total tests. Here on the next chart, you'll see the spread between tests and positives. Again, it's about 92.9% of all tests are coming back negative, 7.1% positive. The next chart, I affectionately call the everything chart, shows you the positives, obviously the increase in 71. Again, a reminder, the 18 in parentheses there is the doubling rate. We discussed this yesterday. The doubling rate is a 5-day rolling average of exponential growth in terms of rate of doubling. And if anyone is out there is interested in the actual formula that generates that number, we'd be happy to share. 139 new estimated recoveries. Hospitalizations is up 17 at a present doubling rate of every 12 days. ICUs were flat, present doubling rate of every 18 days. And we are reporting 7 new losses of life, which has that statistic at doubling every 7 days. Motel room efforts continue. We saw an increase in Public health room occupied and guest, along with regional task force occupied and guest. The asterisks here just reflect an ongoing change in accounting. We'll see some fluctuation in these numbers. We have plenty of rooms available to us, and we'll ensure that we have plenty of rooms to meet the need of the region. But we do expect to see some fluctuation in those numbers. It has no bearing on the need or the ability to fulfill the need. It is just changing how we account for these rooms. On our outreach efforts, we saw increases in everything except hand washing station. Hygiene kits are up, a few more toilets distributed, epi calls, nursing call lines, 211 call lines are all up. Personal protective equipment, again, another good day of every category on this chart showing an increase in this is equipment that we are distributing to our health system partners, and we continue to try and acquire more. Ventilators, all 23 of 23 hospitals reporting 577 available today throughout San Diego County. 94 here at the county are ready to deploy, and all of our efforts to acquire more of those continue to be ongoing. That concludes my report. I'll now turn it over to Dr. Wooten for the Public Health Officer's briefing.
Thank you, Supervisor Fletcher, and good afternoon to everyone, and thank you for being here. Over the past 2 days, we've heard from the President and our Governor about guidelines and the framework, respectively, for how we will start to get back to normal and open things back up. Starting with the federal guidelines, opening up America again. This is that document, and I would strongly encourage you to review it. The federal guidelines clearly state that before jurisdiction can transition to the three-phased approach to open back up, certain criteria must be in place before proceeding. These criteria are across three categories: symptoms, cases, and hospitals. And we have to check off all of these categories. There are 2 in symptoms, 1 either or in cases, and 2 in hospitals. And we, again, have to make sure that we can say yes to those criteria in order to move forward into the phased opening approaches. So for symptoms, the symptoms criteria, which includes downward influenza illnesses reported and downward trajectory of COVID-like illnesses reported within the last 14 days, we have definitely seen through our influenza watch a downward trend in influenza-like illnesses reported in the emergency department. However, as everyone knows, the number of cases of COVID-19 continue to increase every day. So until those numbers start going down, opening back up will be a challenge. Also, I'd just like to let everyone know that our epidemiology and laboratory program is working with the California Department of Public Health to be a part of a community surveillance project to better understand the level of respiratory illnesses, including coronavirus, circulating across California. Now, for the cases criteria, there must be a decreasing trend of cases or decreasing percent of positive tests compared to the number of total tests performed within a 14-day period. Currently, we have been holding at 7% of our total number of cases being positive tests, and that is specifically for San Diego residents. So we will continue to monitor this metric. And lastly, for hospitals, the criteria includes the capacity to treat all patients as needed. This includes COVID-19 as well as patients that have other medical issues. And Dr. Ifantidis talked about this on Wednesday. And the second component or criteria is to conduct robust testing in place for those that are at risk. And that is also an element that's included in the governor's guidance or framework, and that's this document here. And that is California's roadmap to modify the stay-at-home order. So due to social distancing strategies in place, thankfully, our healthcare system has not yet been overwhelmed. And I use the word yet because if we loosen up on our strategies, that could, we could lose that capacity that has been built up. Testing is very important, and again is part of the first indicator for the governor's framework, which is testing and contact tracing. Regarding testing, we know we can and we must test more individuals. So that is why the county has created a laboratory task force that is headed by our county's public health laboratory director, Brett Austin. The purpose of this task force is to convene county hospitals, relevant clinics, and commercial laboratory systems that are responsible for testing throughout our county to look at how these individual systems can increase testing to the capacity that already exists, as well as adding additional capacity. And we will be reporting more on this at our Board of Supervisors meeting next Tuesday. To date, we know that priority populations will include the homeless, as Supervisor Fletcher has already mentioned. Also, we want to focus on our long-term care facilities, which is a priority group in the federal government's prioritized testing groups. And then we will also want to focus on other vulnerable populations. This task force, again, will report on what these various vulnerable populations are at our Board of Supervisors meeting next Tuesday. So the bottom line is we are not there yet, but we have made a tremendous stride in effort, and we are getting there. Next, regarding global, national, and state statistics based on the data from Johns Hopkins dashboard at about 12 noon today. Globally, we have over 2.2 million positive cases and just over 100, almost 151 deaths. Nationwide, there were 684 positive cases reported, approximately, and this includes approximately 34,600 deaths. Statewide, for the state of California, there have been 28,196 positive cases, which includes almost 1,000 deaths. Today, the County of San Diego is reporting 2,158 cases, which is 71 more cases than yesterday, as well as 70 deaths, which is 7 more than reported yesterday. And of the 7 additional deaths, these include 3 females, 1 in their early 60s, and 2 in their early 90s. We also have 4 males in their late 50s, as well as mid-60s and mid-70s. And all 7 individuals had underlying medical conditions. Of the total number of cases reporting today, the range of the age still remains from 3 months of age to 100 years of age. It's about 50% of the total number is in the age range of 20 to 49 years of age, as well as the gender, 50% for both male and female approximately. We have had 524 or 24% of cases hospitalized, and of that number, 181 have been admitted to the ICU, and this represents 35% of those hospitalized. Lastly, of the 70 deaths, this represents 3% of the total number of cases, and 44% were female and about 56% were male. Regarding race and ethnicity, we do not have race and ethnicity data for 12 of the total number of 70 deaths, but of the number 58, which is 83% of the total, 31 or 53% were white, 21 or 36% were Hispanic or are Hispanic or Latino, and 4 or 7% are Asian, 1 or just under 2% are Pacific Islander, and 1 or less than 2% is of multiple races. Our sincerest condolences and sympathies once again goes out to families and friends of the 7 individuals reported today who have lost their lives due to COVID-19. And as a reminder, this information and other information can be found on our county's website. Regarding outbreaks in conjugate and community settings, today we are reporting a cumulative number of 36 confirmed outbreaks. 22 are in congregate facilities, representing 332 cases and 39 deaths. There are no new outbreaks in this group today, and we also have one new outbreak, which is one of 22. One of the 22, rather, is inactive, with no new COVID-19 cases in more than 14 days. Now we have 14 outbreaks in the community setting location, which includes one new outbreak and represents 65 cases and 2 deaths. Regarding testing, as was stated earlier, we are holding at 7% of the total number of tests being positive. The total number of tests conducted to date is 30,246 tests. Again, 2,158 were positive. Lastly, today, I am pleased to finish the announcements of our 2020 Live Well San Diego 19th Annual Public Health Champion Award recipients. Today, we will announce North Coastal and North Inland regions. This year's North Coastal region recipient is Nanette Stam, Chief Health Promotion Officer for Vista Community Clinic. She's also president of the Alliance for Regional Solutions and an active member of the Live Well San Diego North County Community Leadership Team. Ms. Stam's programs focus on maternal and child health, youth development, alcohol, tobacco, and other drug prevention, migrant services, HIV services, and general Vista Community Clinic outreach. This year's North Inland Region recipient is Fallbrook Regional Health District, an organization that provides annual grant funding to local nonprofits for a wide range of health and well-being services. And for the past 21 years, they have invested over $10 million back into the community. So for these efforts, I am very pleased to announce Ms. Nanette Stam and the Fallbrook Regional Health District as this year's Public Health Champion recipients from the North Coastal and the North Inland regions, respectively. And I'd like to congratulate again all of the recipients this year for our Public Health Champion Awards. Again, I'd like to commend the public for staying the course to stay at home to decrease the spread of COVID-19. This sacrifice is a collective effort, and it is indeed working, and we want you to keep it up so that we know that our social distancing strategies will be in place through the end of this month. And at that point in time, we will reevaluate where we are. Remember, if you do leave your place, please remember to cover your face. I will now please welcome back to the podium Supervisor and Chairman Greg Cox.
Thank you, Dr. Wooten. We'll get right to the questions now. Again, as we introduce you, please make sure if your name and outlet is not recognized in the introduction that you do so before you ask your question. We'll go directly to the first call.
ABC 10, please state your name and question.
Pena. We just heard Dr. Wooten mention the testing task force. We have heard from several people who have said that they've had tremendous difficulty getting tested. One person recently told us they tried to go to the ER several times with serious symptoms, were denied a test, finally demanded one. They tested positive and were admitted to the hospital for treatment. What, besides this task force, is the county doing to address situations like this and make sure that people who need tests get them?
I believe Dr. Wooten's going to answer that question.
Well, I am sorry to hear about that particular situation. From the beginning, we have been letting the public know and our healthcare partners that 81% of individuals have mild to moderate symptoms and their illness can be cared for at home. They can go home and not have to be hospitalized. What the task force is going to do, because we know that we are at this point, we have more capacity, and then as we are expanding the platforms that are being added on, we want to make sure that we are focused on the priorities that have been set by the federal government, priorities 1, 2, and 3. So again, this is about education and informing the public as our healthcare system to look at all of the various groups that we can test, so that we will have a better understanding of what this illness looks like in our community.
Okay, let's go to the next question.
NBC 7, please state your name and question.
Hi, this is Claudia Stefanian over at NBC 7. I had a question in regards to the homeless report. So obviously, you guys saw a report where you were seeing that asymptomatic symptoms need to be addressed, and you're now ramping up testing over with the homeless at the convention center. Efforts are now in place. When will we start to see that now be done with the general population, where now focus will be done to testing asymptomatic candidates?
Respond.
I think it is obvious that we do not have enough tests to test the entire population. So that's why the federal government, as our states across the U.S., are focused on the priority areas. And I actually went through those priority areas on last Wednesday, and we can send that information out to you again. But we really want to focus on homeless is one of our local priority areas, individuals that are in long-term care facilities, our healthcare workers, and our first responders. All of these are priority areas, individuals that are older, that have underlying medical conditions, and we want to see where we can expand that, focusing also on individuals with HIV and individuals in low-income areas and areas focused on different race and ethnicity. So that is the focus that has been charged to the task force, and we will report on that next Tuesday.
Okay, we have one final call-in question.
Union Tribune, please state your name and question.
Hi, Paul Sisson with the Union Tribune. I wanted to talk a little bit about what we've been hearing about down in Chula Vista. It sounds like several hospitals down there are experiencing significantly higher COVID volumes than the rest of the county is. I wonder if you guys have done any kind of investigation to figure out where these additional patients are coming from. What are their characteristics?
Dr. Wooten?
Thank you for that question, Paul. The numbers are on the state's website, and we have recognized and have known that the numbers are higher in the southern region of the county. Where those numbers specifically, that area is highly or densely populated, as well as central region. So we know the hospitals and what the numbers are. In terms of and I know what you're getting at, are those cases spilling over from Tijuana? It's quite possible that some are, but I'm not sure that all of them are, or the majority of them are. So the good news is that our hospital system is not overwhelmed, but we want to make sure that that continues, that we are not overwhelmed. And so we are working, trying to work with the jurisdiction, Baja California, to help donors provide resources there so that they can better address the COVID-19 in their region.
I wonder what specific actions public health might take to kind of stem the tide down in South Bay.
Sure. Dr. McDonald would like to take the mic.
Sure. I actually did want to talk a little bit about some of the efforts that public health is involved with. We actually had our first meeting today of a unified command, a task force that is actually specifically looking at issues that are related to the increased number of cases that are near the border. A lot of the same stakeholders in that task force were the ones that worked, I think, very successfully to manage the cases coming from the cruise ships that are in San Diego. And we have laid out some steps to look at what the potential impact is of increasing cases in Tijuana specifically, and those that are quite near the border. We think that a component of the increased number of cases in the Chula Vista hospitals is related to proximity to the border, but investigating that more thoroughly so that we can come up with good containment strategies and mitigation strategies is the focus of this task force. We're also working with the two hospital systems, Sharp and Scripps, to talk about the increased number of cases that they've had there and to work with them to utilize their system to be able to distribute the load of those patients across not only their systems but also the other healthcare systems in San Diego to make sure that there's a fair distribution of the increased workload there. Did that address some of your questions, I hope, Paul?
So it sounds fair to say then that your response down in that area is still being formed. When would we expect to hear something in the public about what is going to change down there in terms of outreach and strategies?
Well, again, you know, we're going to respond to the local dynamics throughout the county. Some of this might be institution-specific. That is, you know, when we find specific outbreaks that need to have direct control measures with infection control initiatives and understanding the dynamics for, say, a specific congregate living facility. I think it's been well reported that there is an increased number of cases at the Otay Mesa detention facility. We're working closely with them to help them with their infection control and supporting them with testing capability, for example. So really, it really is an approach that has to be place by place and location by location and case by case. It's not, there are some things that we will be able to draw, I think, generally from what's happening in that region of the county, but really each one of these investigations and approaches is indeed at the microscopic level, trying to address it situation by situation. And when we are able to draw from that larger conclusions that we can use across the system, we will absolutely do so.
Thank you.
This next text question has to do with laboratory testing, and we'll call on Dr. Wooten to go ahead and respond to that.
All right, thank you, Chairman Cox. Taryn Mento from KPBS. Dr. Wooten, you mentioned the laboratory task force would work to increase testing to capacity that already exists. Can you clarify what that means? Does that mean facilities aren't currently running the full amount of tests that they have the ability to run? And is that because demand is low since we're only testing certain populations?
I think that that answer and kind of the question answers itself partly. I think what's really important is that from the very beginning, we've been telling the population through the media that 80%, 81%, as research has shown, of individuals have mild to moderate symptoms and do not need to be hospitalized. So that message really has gone over well. Say about 10 days ago, we were not testing to the full capacity, and that's one of the reasons we want our task force to look at what are other areas in which we can expand, but we certainly do not have the capacity to test everyone in the County of San Diego. So that's why we've been operating on the priority areas that have been outlined by our federal government, priorities 1, 2, and 3. we will continue to do that, but also look at where we can expand. And when you talk about the priority of low-income populations or the vulnerable populations, that could really be huge. So we have to outline specifically what does vulnerable populations mean for us here in San Diego, and what we are bringing together our county, obviously public health laboratory, as well as hospital and related clinics that are testing, like the federally qualified health centers in our community, as well as commercial laboratories, and to look at where can each of these different entities select a niche or group or areas that they can focus on. So that's one of the charges of the task force. And our goal is to increase testing, to expand it, to include all of the vulnerable populations that I've already mentioned.
Dr. Wooten, I have another one. This is from Marilee Moore with Fox 5, and this is kind of a long one, but all related. In light of the guidance put out by the White House about reopening America in phases, how will that guidance play out locally, particularly with phase 1 indicating some of the first places to reopen will be restaurants, gyms, and movie theaters operating under social distancing restrictions? How realistic is it that our area will have the same target date as President Trump mentioned, which was May 1st?
So this guideline, the guidelines are not about a specific target date, but if you have the criteria in place so that you can move to the next, the three-pronged approach, starting out with phase 1. Again, the criteria must be in place first, and if that criteria is not in place, if we are not seeing a downward trend over a 14-day period of the number of COVID-19 cases, moving to expand could backfire on us, and we could see a reversal in just the progress that has been made so far. So I really want people to really take this seriously, which I know you are, as it is represented by the data that has been shared. And just have patience that we can get through the end of the month so that we can seriously look at how we're going to start to reopen and dial down. We've been dialing up, if you will, with the public health officers' orders, and we really have to have many things in place in order to dial down so that we can get back to some sense of normalcy. I really want to encourage and have people realize that things aren't going to be the way they used to be before. We are most likely, until we get vaccines in place to allow us to get some type of herd immunity, we will have to wear facial covers, the social distancing strategies. Even if we open up restaurants for indoor dining, we will still have to have social distancing strategies in place. So I just really ask people to stay the course.
And again, this one is related from Chris with the Times of San Diego. San Diego City Councilwoman Barbara Bree called today for reopening beaches and parks in early May. Is that a real possibility?
I don't know. We have to look at where we are at the end of this month, and that's what we're asking people to help us do.
Thank you.
This next question is dealing with the Somali community, and I believe
Dr. Wooten is going to
Dr.
answer.
Wooten's going to respond to that.
And this is from Andrea with the San Diego Union Tribune. What is the county doing to assist and inform the Somali community in San Diego? Advocates say refugees face several barriers when it comes to receiving information and assistance because of a cultural and language barrier.
Well, after the blackout in September of 2011, after that occurred, we recognized that there are many populations in San Diego that were not getting the message because of the language barrier. And as a result of that, the Office of Emergency Services, as well as our Border Health program in Public Health Services, began to work together to develop what's called now a partner relay where it brought together 18 different language communities and creating ambassadors within each of those communities to help get information out to their respective communities. So Partner Relay has been engaged throughout the COVID-19 pandemic, and we have translated our health officer orders into 4 of the threshold languages, which includes Spanish, Tagalog, Arabic, and Vietnamese. We have not translated it into Somali, but we recognize that many of individuals in that population are part of the Partner Relay. So that is another translation that we can definitely explore, but they have been involved through the Partner Relay.
Thank you, Dr. Wooten.
I might also add on that last question that 211 San Diego does have translation ability in over 200 languages, so the Somali community could certainly call 211 and they could tie in an appropriate translator. This last question deals with contract tracing, and we're going to ask Dr. McDonald to respond to that question.
And this is from Jesse with the Voice of San Diego. I'm following up on my previous questions to Dr. McDonald about contact tracing. As you know, the state is looking at possibly hiring more contact tracers on the local level and at partnering with tech companies on an app. Any updates from the county's end that we should know about?
I don't have any specific updates at this time. I can tell you that we are looking at the details of the state program to allow us to expand the number of contact tracers that we currently have. We also have had some preliminary discussions with some local academic institutions, and we're looking at how we can retrain some of our own county workforce to be able to do this type of work. That we know is going to be very important as we transition into the future phases of dealing with this pandemic. I too have been listening to the national reporting on how Apple and Google and other companies have been looking at developing apps that may be useful for contact tracing. And again, we're looking to the state's leadership on this score. And also looking at how we might be able to have a local adaptation of those specific apps and strategies to help us with that contact tracing.
That completes our questions for today. Obviously, we've reached the end of another long week, and I want to let you know that we will not be holding a media briefing either on Saturday or Sunday, but our county communications office will be sending out daily updates. The website will be updated as usual between 4 and 5 p.m. on Saturday afternoon and Sunday afternoon, and we'll be back here again Monday at 2:30 for our regular media briefing. This weekend, we hope you take a moment to sign up for the Save Our Homes campaign. And again, it's hashtag Stay Home San Diego, or hashtag Stay Home SD campaign. We would ask that you send a photo of a loved one you're pledged to protect by following a simple request to stay in place, maintain space, and cover your face. To submit your photo or take the pledge, we ask you to go to coronavirus-sd.com. Until then, do remember to stay in place, maintain space, and cover your face, and we'll be back here again on Monday afternoon at 2:30. Thank you.